Hello, everyone. Hi, everyone. We're going to get started with the next session. If you can take your seats. Thank you. We're going to get started on this next session, which is a roundtable on global metabolic health. And I'm quite excited to kick us off this morning by calling on Dr. Jeffrey Lazarus, who's going to give us some opening remarks. But I just want to remind everyone that we have journalists in the room, me being one of them. So just to make sure that you're all aware as you share remarks with us. But please be candid. We don't bite. Jeffrey, would you mind joining me up on stage?
Of course, thank you. Well, welcome everyone. Thank you, Rumbi, and thank you very much to Devix for inviting us into the NCD Pavilion, where we're going to have a focus on metabolic health with, a special emphasis on the liver, which is so important and so underaddressed. Let me just first thank the entire IS Global team, the Barcelona Institute for Global Health, Delphina, Trent, Chris, Paul, Henry, Anthony, Leire, and Lisa, who have been behind the scenes working so hard to make today a really fruitful session for us. Thank you to the Healthy Livers, Healthy Lives Coalition that brings together 5 leading liver associations: the American Association for the Study of the Liver Disease, the Latin American Association, the European Association. You'll be hearing from the heads of those 3 societies in a moment, but also the African Association and the Asian Pacific Association, who are joining us online from abroad. It's great to see the liver associations working together under one banner, the Healthy Livers, Healthy Lives, which also organizes on the 19th of April every year the World Liver Day. I've been chair of that for some years, and it's amazing to see what we've been able to achieve in such a short amount of time. Thank you, everyone, for coming here. This was a very carefully curated event. If you're in the room, it's because we know you have something really interesting to say, and you're going to have a moment soon to be able to say that. We have tables set up. I see it's a little crowded, and there's already some standing room only going on, but we're asking table leads who have been briefed on the idea sprint to get our most important ideas on how to change policy in this field, to make sure they're at the right tables, or we'll rearrange you a little bit later, and we'll explain in a little bit how that's going to work. We have a keynote speaker from WHO who Rumbi's going to address in a moment. We have a panel of leaders from the NCD Alliance, the World Obesity Federation, the International Diabetes Federation, and the Unite Global Parliamentarians Network. So it's great to see these organizations also talking about liver health. And then many of you have little engagement directly with liver health, but you're all engaged in metabolic health, public health and policy. So that's why you're here, to really help us think about how we can end this public health threat, how we can work from a top-down approach, making sure that this set of dynamic diseases is included in the political declaration, but then that we take action on the national, state, regional, and even at the city level. So I'll also thank the endorsers. There's information on the tables about them. We'll also explain in a little while what those postcards are, and I'll also like to acknowledge the funders who made this event possible for us. And with that, I'll pass back to you, Rumbi, to take us through the next couple hours. Thanks so much.
Thank you so much. And as Jeffrey mentioned, we're going to be joined by leaders from 3 liver associations. So I'm going to call upon the stage Grace Su. Grace is from the American Association for the Study of Liver Disease. We also have Debbie Shawcross. Debbie's from EASL. And Maria Gomarias Pessoa, who's from the American Association for the Study of Liver Disease. Thank you so much. You can take a seat.
Oh, I can take a seat.
Grace, we're going to start with you. I know you have some opening remarks that you have for us.
Yes, I do. So thank you very much. I'm Grace Sue. I'm the president of the American Association for the Study of Liver Disease. And I just want to say it is truly an honor, and I'm so excited about this packed room, to be here with our global partners and our partners in HLHL to advance this urgent conversation on liver health. You know, as a liver specialist, we see the devastating consequences of liver disease every day. MASLD, metabolic dysfunction-associated steatotic liver disease, now affects 1 in 3 people worldwide. I would say that is a public health problem. What is perhaps not as well recognized is that MASLD doesn't just damage the liver. It actually drives cardiovascular disease, kidney disease, and diabetes, with consequences well beyond the liver. MASLD is asymptomatic until the very end. And in fact, most people don't realize they even have it. And in my field, I usually see patients when they become symptomatic. And at that point, the prognosis is very poor. The survival is in 2 years, is less than 50%. I would say that's worse than most cancers. So that is why AASLD is proud to be a leader in what is and continue to be a global effort. No institution or region can do this alone. From a global perspective, this means elevating liver health conversations and care, building consensus on screening and care pathways across countries, and ensuring that health systems, not everywhere, not only the ones in high resource settings, are educated and equipped to detect and manage this disease early. So I'm proud to be collaborating across borders so that we can collectively increase liver health on the global health agenda. So thank you.
Thank you so much. And speaking about collaborating globally, Debbie from the European Association.
Thank you very much. So, distinguished colleagues, esteemed partners, and ladies and gentlemen, on behalf of the European Association for the Study of the Liver, it's my great pleasure to be part of this remarkable gathering at the United Nations General Assembly at this side event, which is devoted to advancing metabolic health and liver disease. Obesity not only fuels the 4 pillars of the NCD epidemic that many of you are familiar with, but it also leads to steatotic liver disease that Grace has just mentioned. And steatotic liver disease is a silent but devastating condition. Today, steatotic liver disease affects at least 1/3 of the global population, and it's often undetected until far too late. Even more concerning, metabolic dysfunction-associated liver disease, or MASLD, is now the most common cause of liver disease in children. So we've heard already that it has worse outcomes than cancer, but it also is now the most common liver disease affecting our children. It has a prevalence of 7 to 9% of the general population and nearly 40% amongst all children who are living with obesity. So at EASL, we're determined that liver disease, and steatotic liver disease in particular, must no longer remain in the shadows. That is why we're working tirelessly to integrate steatotic liver disease into the WHO NCD portfolio, where it's not yet recognised, but where it needs to belong. We cannot forget that steatotic liver disease is absolutely preventable. So I'm proud to be part of this strong global movement, and together with our sister societies here on the stage, as part of this coalition and under this shared flag, we are uniting voices worldwide to raise awareness, elevate the profile of liver disease, and drive policy change. Thank you.
Thank you so much, Debbie. And Mario, last but not least, I'm going to turn to you.
Thank you so much. Well, hello, everybody. I'm Mario Pessoa, the Vice President of the Latin America Association for the Study of Liver Disease, ALE. Latin America has a prevalence of MASLD of 44%. That is higher than the global prevalence of 32%. We also have a prevalence of MASH of 7% in Latin America, which is also higher than the global prevalence of 5%. So I'm proud of being part of the Healthy Liver, Healthy Lives Coalition, and we just released a paper with the coordination of Professor Yanossi together with Jeffrey, that it could show the burden, the economic burden of MASLD and MASH in several countries, including Brazil. And Brazil had shown a prediction for 2040. So Brazil had shown a very high economic burden by 2040. And that is only lower than the US cost by them and higher than most of the European countries. So I think we have to come up with very good strategies to try to prevent this global burden of this metabolic dysfunction, steatotic liver disease. And I hope we will come up here with very good ideas. Thank you so much.
Thank you so much, Mario. I think you guys really set the stage for the conversation and told us what's at stake. Thank you. And next up, to further set the stage for our round tables that will come up later, I want to call upon Dr. Vanessa Garcia Larson, who's from the Pan American Health Organization. She is going to be our keynote speaker for today. Just
1, 2. Well, thank you all very much for the very kind invitation to join you all to talk about this extremely important issue. I'm honored to be here with so many colleagues, public health leaders, experts, patient group advocates, and also those who join us today via live stream. I'm honored to share this space with you all today because we are addressing global metabolic health and non-communicable diseases, including metabolic dysfunction-associated steatotic liver disease. As you probably know, NCDs are the leading mortality cause worldwide, and in the region of the Americas alone, they represent 65% of all deaths. Lifestyle-related risk factors, including unhealthy diets, tobacco use, physical inactivity, and harmful use of alcohol, are all recognized as main drivers of NCD trends that we currently observe. However, the environments that we live in also greatly influence what type of lifestyles we have, what we eat, and how much we move. MASLD is estimated to affect 1 in 3 adults worldwide, as you've heard already from Professor Grace Su. But it's also the main cause of liver transplant. The increase in the burden of MASLD goes hand in hand with the increase in obesity and several metabolic-related conditions. And the risk factors for developing MASLD include overweight, obesity, having insulin resistance, hyperlipidemias, and hypertension. We know from all the scientific evidence that weight loss, moderate to moderate weight loss, adherence to high diet qualities are currently the cornerstone for the management and prevention of MASLD. It is clear that non-pharmacological interventions that include changes in diet and physical activity are critical to curb the growing burden of NCDs. In the last 25 years, adult obesity increased by 60% in the region of the Americas. And we've also observed a massive increase in adult diabetes prevalence and physical inactivity. I'm certain that you're going to hear this often during this week, but unless risk factor trends are urgently reversed, we will not meet the global target of reducing by 1/3 premature mortality of non-communicable diseases through prevention and treatment. MASLD is an excellent example of a condition that would greatly benefit from public health policies that address lifestyle-related risk factors. And to this end, the World Health Organization and the Pan American Health Organization have long advocated to support member states in the implementation of healthier food environments and promoting safer environments that facilitate the practice of regular physical activity. For example, the World Health Organization's best buys are highly cost-effective interventions for the prevention of non-communicable diseases and well-being, and are a core part of the WHO's global strategy to tackle NCDs by addressing their major risk factors. We are facing major challenges to meet public health recommendations that avert the risks for NCDs in general and for MASLD in particular. We need to have environmentally sustainable and healthy diets, promote safe environments to move more. We need targeted community-based interventions, and we need more advocacy for access to treatment and care. I'm sure that during this session we're going to have the opportunity to discuss strategies to move forward, to address the main issues related to public health, and how we can prevent and improve the current trends with non-communicable diseases and with MASLD. And I very much look forward to our dialogue today, which is certainly going to provide a way forward to address metabolic conditions. Thank you so much. Thank you.
Thank you so much, Vanessa, for those words. And we are going to go straight into our panel discussion. So I'm going to call upon our panelists to join me on stage. We have Dr. Simon Becerra, who's from the World Obesity Foundation, Professor Peter Schwartz, who's from the International Diabetes Foundation, Katie Dane from the NCD Alliance, and Honorable Amira Sabera, who's a Member of Parliament for Egypt. Please join us on stage. Come on, Katie. We're missing Amira for this discussion, but I'm sure we will be able to soldier on. Please take a seat. Okay, to kick us off, we often talk about liver disease as something that's forgotten when we talk about NCDs, and in this week when we're having this high-level meeting on NCDs. From your perspective, how can liver advocates, what lessons actually can liver advocates learn from other diseases such as cancer or cardiovascular disease? How can we get liver on the agenda? I'll start with you, Katie.
Sure, thank you for the question, and it's a real pleasure to be joining you today, and thanks to Jeff and IS Global for bringing us all together during this very important week for the broad NCD agenda and liver disease community specifically, of course. So to the question of, how can we ensure that liver health is part of the NCD agenda, and what are the tips for advocacy? I mean, I think the first thing to say is that obviously, on Thursday at the high-level meeting on NCDs, governments will be adopting the final political declaration that has been negotiated over the last 3 months. As we all know, it's been a tough negotiation, a reflection of the broader challenges geopolitically, I think is a fair point. But I think the important thing from a liver community perspective is that liver is included in the political declaration in a specific paragraph. This hasn't been achieved in previous declarations, to my knowledge, so I think this is a really important win for the liver health community, and one that a lot of people in this room, I'm sure, contributed to and made happen. But I think, obviously, the high-level meeting in this week is not some sort of kind of cliff edge. We've all been working towards it for 2+ years. This has been a major focus for us as the NCD Alliance and many of our members. But obviously what happens here is one thing, and then what happens after is even more important. And it's really that shift to the national and the regional level in terms of really taking this lofty declaration with many different pages and many words into something that's really actionable and tangible to each country and community. I think, as I say, this gives a kind of entry point for the liver health community and another tool in your toolbox, as it were, for advocacy. I think there's obviously a real need to keep the momentum going at the global level and think about what are the opportunities coming up at the end of this year and next year for liver and NCDs to be really keeping that momentum going. For example, WHO updating their global monitoring framework on NCDs next year, a really important opportunity. But also just really trying to kind of make sure that we've got strong government champions around this agenda. You know, I think we always see in these negotiations, it really just takes one government to step forward and say, we want to see this issue included in this document. And so having champions in all different regions and as many countries as possible to really push our agendas forward is critical, as well as obviously really trying to make sure that we work as a coalition. You know, an NCD Alliance is an organization of 500 plus members, including really important ones from the liver health community, trying to join forces as much as we can around that aligned agenda that we're all focused on is critical.
Peter, I saw you nodding your head as Katie was speaking. How do we keep this momentum going? And actually, maybe a question that I should have started with is, why do you think liver is forgotten?
So many questions. And first, I would like to thank Katie. This was a very, very strong statement that we have to fight for including liver into the declaration, but even more important, that we have to fight for actions, what we do for people who are having liver disease, who have liver fat, and so on. Why I'm so keen on it as the president of the International Diabetes Federation, I want to make it very simple. If you fry carbs at a temperature of 130 degrees, you build bonds between fat and glucose, you eat them, and where are they getting stored? In the liver. And the body needs a lot of energy to break it down, it's not doing it. So this is, in my eyes, MASLD, MASH, and this is the main determinant of it's like a catalyst of driving the development of diabetes. If you're in Europe, people living with diabetes have a period of 7 to 10 years of pre-diabetes and then convert to diabetes. If you are in India, where liver fat is very prevalent, it's 7 to 10 months before they are developing diabetes. So it's the devil's in the development of diabetes, hypertension, metabolic syndrome, dementia, depression, and many, many other chronic diseases. And I think I have not to add anything else why it's relevant from a diabetes perspective. But now think as a simple-minded diabetologist. If you sit there and say, okay, the fat in the liver, if you have 100 grams of fat in the liver, we become a non-responder to physical activity. If we know this, if we have the evidence this is relevant, we have to act to remove the fat out of the liver. And even there, the evidence exists. Taylor, 2 years ago, 3 years ago, has shown if we have the fat in the liver, we also have in the pancreas, and this is destroying beta cell function. If we remove it out of the liver, we also remove it out of the pancreas, and it may restore beta cell function and may lead in about 50% maybe the case to remission of diabetes. And now a dream is getting true. We are able to tackle liver fat and may lead to a remission of diabetes. And this is a fascinating hope. And for me, this event, sitting here, listening to Katie, what we have to do step by step, is a big seed in a fertile soil where we should grow a very big, strong, large tree called common and conjoint action to tackle liver fat as catalysator determinant for global chronic diseases. And it's maybe not needed to be, I apologize for what I'm saying, here or in Europe. But if you think about Southeast Asia, if you are thinking about Africa, this is where we have to make an impact for the very fast-growing number of people living with diabetes. And I think the situation was never as good as it is today. Katie has mentioned that. You are here in the room. There are so many advocates who are passionate about building a global coalition to act on reducing the amount of fat in the liver. Thank you very much.
Peter mentioned a global coalition. Simon, I'm curious from you, how can we get people to work together around this issue and build stronger alliances?
Thank you, Rombi, and thank you to Devex, to Jeffrey, and all the team for the invitation. I agree with Peter and Katie that this is very important to have in the agenda the liver disease, fatty liver disease, as one of the major components of the burden of non-communicable disease that we need to solve as international health community. I also think it's very important to be concerned about access to treatment and to a good integrated response from primary healthcare. But the other part that I am really concerned is prevention. And being from the public health world and being Mexican, I can tell you that one of the main drivers of this epidemic is soda consumption. Is very high, and I can tell it, to you from a country in which we consume 168 liters per capita of soda per year. And I think it's very important to have also a concern on what are our positions on how to prevent this. I think one of the main tools we have to stop this epidemic is with public health measures to prevent consumption and to stop these drivers. And one of these is the soda tax. I regret that it was removed from the declaration, because we all know that the evidence is there, and we know that it was removed because there was some interference from industry in different countries. And we need to point out that, because we really want to solve the hepatic liver disease. And well, this is one thing in which my government and the World Obesity Federation are going to work very hard to think not only on access in primary health care and not only in treatment, but also how to effectively prevent the drivers that are generating this increasing condition. And in Mexico, it's the fourth cause of death, hepatic cirrhosis. Thank you very much.
Thank you so much, Simon. You mentioned a really interesting point there, which was the tax for sodas and sugary beverages, and which brings me to another point. I think the most important thing is what happens after the declaration, what happens after the high-level meeting. So from your perspective, what are sort of some of the barriers that stop this legislation from happening, and how can we engage with governments? I will start with you, Peter.
I was hoping that I don't have to answer this question. I apologize. The barrier for what happens afterwards are we and our governments. Having a zero draft document 4 months ago, which was well written, which had a lot of good content, and what we have today, or what we will have in 2 days from today, it's very washed part of it. And I can understand that politicians sometimes try to exclude everything what makes them responsible for something, but this is unacceptable. We have to act. We know, we are scientists, we understand the field, we are the ones who lead organizations who can mobilize millions of patients, who can mobilize millions of advocates, and we have to translate this power and this influence into action. Yeah, because if you have a good document, if we talk together again and discuss together, no diabetes is prevented, no liver disease is prevented. We have to walk together to translate this into action. And I hope you asked me a question what IDF can do to tackle this. And one of the steps we are going, because we are more and more, this is a wrong word I'm using, fascinated by the easiness of liver fat being a determinant. And we will release a guideline on fasting and diabetes in April 27 in our World Congress in Qatar. There are more than 200 experts worldwide currently working on it. 19 different fasting styles. And some of them have a brilliant effect on reducing liver fat up to a level, if it's with prolonged ketosis, to abolish the liver fat totally. This is becoming very fascinating. There are more diabetes patients in the world who do fasting than those who do not do fasting. So this is a strategy with all the monotheistic religions have included. So there is a habit. It's our social environment. Using this as a targeted health strategy could be a part. Of course, we also have a lot of brilliant new molecules, brilliant new drugs. But for me, the goal would be how sustainable is this? Using the dual agonist, the triple agonist, and the debate goes away and you reduce the liver fat. But if you stop the drug and it's coming back, it's not a sustainable opportunity yet. We have to work to make this more sustainable. So I think whatever we do, everyone in our environment, in an organization, in your university, in your little practice you have, you can do actions to advocate your patients, advocate your stakeholders. You might know the Minister of Health, you might know Katie, who can help you to get into this network, and we should use this to act and advocate for actions on reducing liver fat. And I want to use the same final statement again. I truly believe the situation was never as good as it is today. We know what we can do. We have the coalition. We have many ministers of health who really want to tackle the growing prevalence of chronic diseases. And let's be the advocate for translating it into practice.
Thanks so much. Katie, Peter had some really strong words about the declaration and how it was diluted. Do you feel the same way, and how can we make it work post this week?
Sure. I mean, as I kind of alluded to earlier, I mean, this is a declaration that's been negotiated at the political level here in New York. It was always going to be tough. It was always going to be a challenge. And I think, as always with these NCD declarations, we've had 3 before. This is the 4th. There are some things that are good. There are some things that are weak and fell short, right? And I think the things that are good are things like a really strong focus on primary healthcare. That is new, that is really refreshing. A whole section on integrated care, primary healthcare, people-centered care, important for all NCDs and liver health. It's really, really refreshing to see, overall kind of a broadened approach to NCDs, liver being included in there as one of the diseases. I think that's a really important takeaway. But there's obviously issues that fell short. Health taxes, Simone already mentioned, completely a missed opportunity. The fact that we saw in the zero draft a concrete target on 80% of countries, including health taxes, that got completely dropped. And going to your question to Peter, what is the reason for that? The reason is completely what Simone was saying earlier, I think, is just, and there's clear evidence for it, it's industry interference. It's interference from health-harming industries. And we've seen it time and time again throughout these negotiations. Why has the whole section on health-promoting environments in the declaration got watered down, whether you're looking at it from alcohol, whether you're looking at it from tobacco, unhealthy diets? So many of the interventions that governments have already agreed to and WHO recommends in terms of the best buys got completely watered down. That is a reflection of the world, the kind of landscape that we're negotiating these documents in. But to your question, I mean, what do we do next? I think we really have to take the good from the declaration and keep moving forward. I don't think it's in our best interest to be, constantly talking about the negatives of the declaration. We need to kind of concentrate on how we can use the words in that declaration for advocacy at the national level, because that's where the rubber hits the road. Global conversation's critical, important. It's what my organization has focused on for 16 years. But essentially, it's the national advocacy. It's getting policymakers to implement what we've been saying for 16 years is the most important thing.
Maybe I'm allowed for one sentence. I was so critical about the declaration. I want to be very positive about the declaration because we all can use this declaration because the right words are in. Not as deep as we want, but liver is in, prediabetes is in, diabetes is in, all the common diseases are in. So we can use it and say, here, you minister, you have signed this, that this is becoming a priority. And now we help you to translate this into action. And this is coming back to the question you asked me, this is what we should do. If we don't do, we fail. We cannot ask the politician or to do the coaching or the treatment for our patient. We have to do it, and let's do it in the right way.
Simon, I want to jump to you. What are the next steps? What next steps do you think we should be taking?
Well, there is a Lancet series on ultra-processed foods that is going to be presented in November. And I think the main call of this series is on rebalancing the power, just to advance in action. I don't think, as Peter, that is politicians, really. I think below the politicians in the different governments, there is a very strong, powerful corporations that sell junk food and that pressure some of the governments. So we were seeing actively some countries asking to remove these components of the declaration, and it's not that the country doesn't want to protect their children or population from sugary beverages. It's that there are very powerful corporations behind, and we need to rebalance that power. So I think one of the next steps will be to develop action networks, well, just like NCD Alliance and World Obesity Federation, but very focused on these drivers that are critical to advancing the prevention.
So we have 1 minute left before we need to move on to the next section of this, but I want to ask each of you a question, which I thought was really important and forward-looking for us. If you had to choose, what would be one innovation? It can be policy, financing, or technology that you would consider a game changer in the next 5 years. Katie, I'll start with you.
Difficult question. I'd say something that we've already talked about, which is health taxes. I mean, we know it's a win-win-win for health, the economy, and actually reducing healthcare costs in the health system. At these times of extreme fiscal constraints, whether it's internationally or nationally, and nationally most importantly, this is a really important tool for governments to both reduce consumption of unhealthy products and also increase revenue for potentially health and other important issues. So I really think health taxes has to be kind of a focus and a priority.
Because Katie has chosen the taxes, I would choose developing a biomarker indicating very early stages of fatty liver disease and using strategies of fasting to reduce the amount of liver fat and abolish liver fat totally.
And
since you have mentioned those two drivers, I will mention that maybe one in which we need to work a lot is also the marketing directed to children. This is a huge driver that shapes consumption and preferences in very early stage and converts humans into consumers of unhealthy products. So, and it's very difficult because all the marketing has migrated to digital, and it's very difficult to monitor, to evaluate, and to regulate. So this is one of the huge challenges. I am happy that this part is still there in the political declaration, but we need to do the specifics and start a very intensive action. Thank you.
And I would like to remind all of you, not about liver fat, but I'm president of the International Diabetes Federation, and this organization gets tomorrow 75 years of age. So we are one of the, I will not say old, but experienced organization. I would like to thank, because many of our advocates are in the room here, thank all the people for this commitment, the passion, the energy to build up a global community to act on behalf of people living with diabetes. Thank you very much.
Thank you so much. And I was actually going to ask you guys to clap and help me to thank my panelists. Thank you so much. Thank you, everyone. We're now going to move on to the next part in our agenda, which I think is really